Thank you for staying tuned. As we promised, tonight we'll be talking about the flight of health workers. At this time where we are facing a pandemic, we are having Mr. George Gibore. He is the General Secretary of the Kenya Union of Clinical Officers. Thank you, Mr. Gibore, for joining us tonight.
Thank you very much, Irene, for having me.
All right. Now, let's start from a point where on Sunday, the National Advisory Council of the Kenya Union of Clinical Officers gave a strike notice, which is a 14-day strike notice to strike. Why did you issue this particular strike at a time where the nation is facing a pandemic and we have seen different institutions of health workers such as KMPDU and the Kenya Union of Nurses also issue a strike notice? Why is this clamor for a strike at a time where we are facing a contagion here in the country?
Thank you very much, Irene, for that question. And I think that's a very important question for Kenyans to understand. That indeed it is not by our choice, but the push that we have been pushed by the government and the employers for being in action for several times that we have been trying to engage them. It is good for Kenyans to note that since the inception of the COVID-19, we, the Kenya Union of Clinical Officers, have done more than 11 memorandum, including the recent one that we served them on the 16th of this month, that's November, and we gave them a clear demand. And I need to mention some of these issues so that Kenya can look at it, that indeed are we being malicious or is the government that does not mean well for the healthcare workers. Right. That we have requested the government to consider actually exempting people who are within the vulnerable group. And when I talk about the vulnerable group, I mean that the people who currently are affected advancedly with the COVID-19. These are those with 55 years and above, the pregnant and expectant mothers, and also those who have pre-existing condition and diseases. So it is only reasonable that they be exempted from active duty because we have considered and seen, and as we are talking, of course, we have lost now 8 clinicians, including the one that we lost to today, and may their soul rest in peace. We want to say that all of them belongs to this vulnerable group, which we will have avoided, because if these people are in active duty, then we want to believe that there is a reasonable reason why we are raising that issue, and including the WHO has advised the ministry the same. Beyond that, we are asking that the government provide what we call a comprehensive medical cover that is sufficient enough to actually help these healthcare workers to get medication once they are hospitalized in case of any infection or any complication with the COVID. As it is, the healthcare workers, including the clinical office, have been left actually to do harambes to ensure that they are able to foot their hospital bills. This is the most painful things that we can be able to have in this country. Knowing that these are the frontline healthcare workers, the soldiers that we are using to fight the COVID-19. And having said that, it is realistic that we have to lose people. Because once you are in the fight, you lose people, but we need to minimize. We can minimize that, and that's why we are saying that. And we are saying that the government, what need to do currently is also to ensure that we have at least a group of life insurance where we can be able to get compensation for the survivors and for the victims. And this is not too much to ask. It happens elsewhere. And the majority of the country now, because this is a world issue, they are doing the same for the healthcare workers. And there is no way our country can lack and cannot see the sense of what we are talking about. Even when it is so sensible that we are losing over 10 people on a single day due to what we could have even avoided. It is very painful. And I proceed to mention another thing, that the healthcare workers now currently are working under very dire situation. They are risking their life. They know that the first bullet to come might be on their life. And it is very true that once you are infected, you go home to meet your people. And we have had healthcare workers infecting their people. So we are saying that we need the government to harmonize what we call the health risk allowance to ensure that they are motivating these healthcare workers who currently have a lot of anxiety, and they are human beings. They are fearing what is happening, and when you see your colleague has gone, you really actually guess that you could be the next person. And this is a psychological torture to these healthcare workers. And that is why we make a clarion call that the decision must be made. It does not require that the magnanimity of the budgetary allocation that we have been seeing people talking about, but only a little money, not even 14 billion that we are projecting to use for BBI. But we want to say that at this time around, we need to prioritize it, right? Let's motivate these healthcare workers so that they can feel comfortable serving both psychologically and can be able to continue working. Let me mention another thing that I need to mention, that after the inception of this condition, indeed we have a severe, what we call shortage of healthcare workers. The government moved to employ healthcare workers. However, they employed them on what we call irregular and illegal contract because it does not meet the provision of the Employment Act, which provide that if you employ someone, you must pay them equally for the people with the same qualification and offering the same job, pay them equally. So that one, it does not happen. These people are paid peanut, including 15,000 up to 50,000, which is a major, and it does not actually substantiate the reason. And we are saying that the government need to consider these people to be translated to permanent and pensionable, so that they are feeling comfortable also like their counterpart. We are working under one environment. They are actually serving in an isolation center. They are actually the one who are being infected. And I need to mention that, of course, one of these people, those who are employed under COVID and UHC, have succumbed to the condition. And unfortunate enough, this people, she died before even she earned her first salary. Now, it is again very painful that up to 6 months now, they have not received their salary. What kind of leadership do we have in this country? But at this time, you ask people to ensure that they are feeding well. You expect them to commit to work. You expect them to have a presentable, to be presentable before their patients, and you still deny them to pay up to 6 months without any warranting reason. We have seen money being actually stolen at the KEMSA. It is very painful, and we normally feel that it's because we have leaders whose priority is not with the common Kenyans. Yes. Now, there has been an issue which I've had KMPDU complain about, nurses complain about, and now clinicians are complaining about the issue of the PPE or the protective gear. Now, there's something that is not meeting the eye. When the Minister for Health, Mutahi Kagwe, goes to the Senate, he says KEMSA has PPEs in the stores. But you're having the clinicians, the nurses complain they do not have the protective gear. What is not adding up here? Thank you, Irene. I was actually moving to that. I know that it is one of actually the first issue that we have requested the government. I know they have not finished on our demand, but I need to go where you have asked me about the PPEs. Now, I want to be very specific that when we complain that we do not have PPEs, it's not that we are being malicious as the government want to portray. Mutahi Kagwe announced that we have enough PPEs. Where are they? Kept in the store. Are they being used? No. So you cannot be calling that you have enough. And what do they need? They need to be procured. How long can you procure anything in this country? It takes several days. It takes months. Now we are saying, currently we are working. As we are working, I've been moving around. I went to Nakuru, I've gone to Embu, I've gone to Meru, I've gone to the recent past Eldoret, and I've gone also to Baringo. all the places we have gone, including even Migori, and here Nairobi, even where we work, I need to tell you, it is unfortunate, including Kiambu, that the majority of these facilities do not comply to the policies that have been put in place by the Minister of Health. And as we talk, we have several counties on strike. Garissa, we have Elgeyo Marakwet, we have actually Mombasa, they are on strike. Reason? Very few things, including now the adequate supply of recommended or right PPEs for the healthcare workers. Now let me crystal that one. That when we talk about right PPEs, people presume that it is just a mask. And not just any mask. The Minister of Health, under the advisor of the WHO, went on and prepared a very good policy that says if you are in the hospital seeing patient, you are supposed to use what we call N95. And now what does N95 mean? That you are more secure because you are seeing many patients. And that is in lieu of that the facility and our consultation room are required time, and some of them not well ventilated. So you need to be well protected. Now we are only getting what we call a surgical mask in place, which 99.8 of our healthcare workers are using. Actually, the point that I'm leaving out are those who are working in isolation center who are privileged to get the N95 when now they are donning the full regalia. So when you see what is happening is that you are given a surgical mask to use for 24 hours. What is the rightful time to use a surgical mask? Is within 3 to 5 hours maximum. Because at the end of the day, you are touching patient, you are touching services, and you go back again, you touch the mask. So this is to mean that you are exposing yourself. Until we have the right PPEs, if we are told we cannot be able to have what themselves have entrenched on the law and the policies, then let's have the surgical mask be used as it is recommended. For at least not more than 5 hours utilization while I'm serving, so that I can be able to take it off and wear a next one, which is, I am quite sure that it is still clean. Now, having said that, once you are working in the health center, you are or rather any hospital, you're supposed to have something to cover your face, that's a face shield or goggles, or even cover your head, and also boots, and now apron. For you now to feel at least once you actually doff it off, then you are sure that at least you can move and unclean yourself, and you have not carrying along any iota of doubt that you could be infected. So these are not there. And I dare ask the government and even the media to do the due diligence, move around, and get to find when the ministry always announce that they have enough PPEs. Where are they? Unless they have their own mind that there's PPE somewhere, I don't know who utilized those PPEs which are in KEMSA. In any case, we are calling for the ministry actually to release those PPEs that they can be able to be used. We cannot be boasting of something that is kept in the store, and the healthcare workers are dying of this disease. And this disease that, this death that we are seeing, as they continue increasing day by day, we want to say that they are actually avoidable, and the government must take responsibility. It is unfortunate that we are negotiating on life of people. This is the kind of leadership we have that we cannot tolerate. All
right. Now, moving away from that, once you issued the strike notice on Sunday, have you been able to get the audience of the Cabinet Secretary for Health, Mutahi Kagwe, or from any official in the Ministry of Health to sort of hear what are some of the reducible minimums that you're calling for?
Irene, before we called for this strike, which we called yesterday, and today we moved to formalize that by serving the respective institution, including the ministry and the counties. We, on the Sunday of 15th, the date of 15th, we were also on media where we gave our demand letter. And the demand letter equally was served to the employer and the respective institution on 16th. No one even dared even to listen to us. And I've mentioned that we have served the ministry with more than 11 memorandum. And you must be able to remember, during this time of COVID, already there have been several strike notices that has been issued, actually numbering to around 5. What is the reason? Protection, safety of healthcare workers. And also to ensure that these healthcare workers, their welfare is well taken care of. But unfortunately, let me tell you that even some of those letters, we want to feel that if there was any good willing leadership, will have been called on the table.
Yeah.
Please clarify what you really want. How do you want to feel safe? You know, when you start making noise, I must come and get to know, what is this that is happening? We have leaders that who are not available, and we feel they are the problem that the healthcare workers are undergoing.
So who in particular was not available? Is it the Cabinet Secretary for Health, Mutahi Kagwe? Is there a stumbling block? Because I've heard some say they have not been able to access the CS for Health. Is that the case here?
I believe your guess is as good as mine. And we are saying, you know, in this case, the issues of management of COVID-19, we have seen the president being the leader and taking the lead to ensure that things are happening the way he wanted to be and the country will want it to be. Always, even when now people started not trusting that there is COVID, it is the president who led to that. So we are saying the buck stop with the president.
All right.
Once the president sees that the people he has appointed to office are not available, he needs to be available for the people.
Right.
And indeed we need to say that he has held several meetings. He has not provided any platform for the healthcare workers to leadership and representative to reason with him and present their petition to him. Despite the ministry also being there, and I want to believe that once the president has appointed the minister, like now Mutahi Kagwe, Mutahi Kagwe need to be there always because he need to be in between the employees and now the president.
Yes,
so that if there are issues that are touching on healthcare workers that he cannot be able to make a decision on himself, he present them at the cabinet level so that the cabinet level can make a decision where the president is fully participating and chairing those meetings. So we want to say that we are fully feeling that as we are, our friends are dying because of COVID and the poor Kenyans are dying, the politicians are quite happy on their corners. And that is why we know that. And when I say about politicians, we need to get to know that most of our leaders, including in the Ministry of Health, those are politicians. They have been in the politics, and they do not actually feel the pain that healthcare workers are feeling, if indeed they dare. And we have been seeing them announcing data of the death and the infection, and of course not telling us what they want to do to avert the situation. And as we are saying, is that we feel that we have been neglected, we are on our own. And indeed, I need to tell Kenyans that Mutahi Kagwe came on national television and said that if you get COVID-19, you are on your own, including healthcare workers. And he said that the NHF have got no money and money enough to ensure that they can be able to provide insurance for any person who has been infected. So there is no, it cannot be able to fit, to foot any bill. So we want to say that we are on our own, and indeed this is not only for the healthcare workers, but also for Kenyan, that you are on your own, and your leaders have chosen to take to the comfort zone.
All right. Now, we know that health is a devolved function, but when it comes to COVID-19, there have been sort of a collaborative sort of approach between the national government and the devolved units. Now, are we seeing, if you say that maybe CS for Health, Mutahi Kagwe is not hearing the plight of workers, we say the president is not hearing the same, have we seen the devolution unit now take focus on what the health workers are calling for, especially the clinicians?
That's very true that indeed the devolution and the counties have a role to play. When it comes to the COVID-19, I think I have not forgotten very well that some of the county wanted to announce their own result and manage the way they will wish. It was very clear that it was announced from State House by Mutahi Kagwe that the management for COVID-19 will be done centrally. And that's why they constituted a team that involves the county and the national. And that is why the resources, all the resources that we have gotten, including the one that I've seen that the US is going to add to this country, we know that it comes to the national government. Then that's why we are saying, if we cannot see anything happen, there is no way the Minister of Health can be able actually to stay away from this unless they are indeed declaring that they are abdicating their duty and their responsibility, because they declared that they are the leader in this and they be able to manage everything. And you saw Mutaika moving from county to county, to county, and we want to believe that it was in good intention, but we are not seeing any result.
All right. Now, today you met the senators, of course, the Senate Health Committee, to sort of give them your grievances concerning what you're calling for. Perhaps could you tell us what came out from that meeting? Was it a fruitful deliberation on what health workers are facing at this time of battling the pandemic?
I think we were invited to the Senate Committee on Health to ensure that we are giving them the update and on the issues of the increasing infection among the healthcare workers and actually the rising death. So we gave them the update, and I think that they still need more time to call the other leader, including the ministry, so that they can be able to discuss and provide a way forward. Irene, I want to believe that if they mean well, we want to see them actually pressing that we need the ministry and the people responsible to ensure that they are making decision on the grievances of the healthcare workers. Because that's why we are saying the Labor Relations Act provides for 7 days. We have given 14 days. 14 days are enough to resolve the issues we have asked them to consider. And all these proposals, not all of them need money. In any case, when we talk about PPEs, they are saying they already have the PPEs. It's just a matter of ensuring that they are aware they can be able to be used, and the healthcare workers are feeling comfortable. The issues of what we are calling now the the health risk allowance, and also the life insurance. Those are things that we need to hear a pronunciation like tomorrow. Is a decision that they need to make deliberately to make the clinical officer and the other healthcare workers to feel comfortable. The issues of harmonization of the health risk allowance. Once you are taking, including the soldiers that we took to fight in Sudan, they were able to be provided an extra risk allowance, including other money, that it is out of their salary. Now we are fighting with a killer disease that is killing unseen enemy. So the enemy that we cannot be able to see is killing the healthcare workers, and we are only asking that harmonize the health risk allowance for healthcare workers, more specifically the clinical officer, who are majority are not getting anything.
All right, now,
and let me finish this, that for those who have been put on irregular contract, and there is court orders against this, the government is not adhering to the court orders. And that's why we are worried, Irene, that we have leadership in place who cannot be able to follow the law and actually implement the orders that are there. So if you see that we are calling that they need to transit these people from this irregular contract and put them on permanent and pensionable. Pay them immediately, because they have already worked for 6 months.
Now,
so it is quite painful for us.
I know we are pressed on time, but finally, what if the government goes to court and halts the process of striking? What will be your next move if it comes to that?
I think we are patriotic enough, and we are law-abiding citizens. We will obey the court order. But remember, the OSHA Act provides, and of course, that if you're not feeling comfortable where you are, then you need to flee. You cannot be forced to work. And let me tell you what, Irene, might happen if they are forcing healthcare workers to work in a situation where they are feeling that they are not safe. All of them will flee. And what happened? All Kenyans will lack any person to see them. And when we see this happening, I need to finalize and say that we need a coordinated management of the health sector. And that is why we are saying, if indeed there could be any one gift that the president can give this country is to ensure that the healthcare workers and the poor Kenyan who seek services in the public sector have what we call a health service commission.
All right. Thank you so much, Mr. George Gibore, for making time. We wish you all the best, even as you push for your irreducible minimum to the Ministry of Health, of course, and President Uhuru Kenyatta. Of course, that and much more we'll be discussing, even as this situation continues to unfold here in the country.
Thank you very much, Irene, for having me. I need to tell Kenyans that for those who are still doubting whether there's COVID, please be quite assured that there is COVID. Right. I've heard people saying they have not seen anyone who have sick or who is sick or who have died of COVID. Right. I need to tell you, as you wait to anticipate anyone, you might be the one who is going. So ensure that you are actually observing the containment measure, keep social distance, wash your hand all the time, and ensure that you are putting on your mask all the time you are in the public space.
All right.
Thank you very much.
Thank you so much. As you've heard, there is Mr. Gibore giving us an advice. We are taking a break. We'll be back. Do stay tuned.